Thanks, Nastya. Don't go away too soon, though, because we have time for one or two clarifying questions. I knew that Bob was burning with a question.
No, I thought that was very interesting. I think this will end up being a useful parameter. My only suggestion is, probably not everyone in the audience realized until at least I didn't realize that when you were talking about growth, you were talking about TTP growth. And I think many people probably would initially interpret this as you're saying something about TB growth in the cultures, and that's different.
No,
so
it's a parameter that correlates, that we could relate to.
Yeah, so I would make sure people that.
Yes, that's an absolutely fair point, Bob. Thank you. And it's a parameter on the increase of TTP, meaning decrease of culture-based organisms. Yeah. Norbert?
So thanks very much for allowing this one more question. So I understand your results in a way that you're saying if you limit your observations to up to 2 weeks, you're not able to discriminate as much between the different patient groups as you would if you had longer observations. Now, I would like to ask you for help with possible conclusions. Does this mean that that you might not have had enough data points in these 2 weeks? Understood these studies were only taking weekly cultures, or does it mean that 2-week studies per se are probably not as predictive as longer studies?
Actually, both apply. So from 0 to 2 weeks, we did not have enough data, and based on that, we were not able to predict gamma in a way where we would be, making clear conclusions. So we would need a longer period. In our case, like it was at least 4 weeks. So you are able to, to make, conclusions, and you don't have to follow up to 12 months to take the same decisions.
So provided we had more data points, like doing an EBA study with daily or, I don't know, 3 times weekly cultures, might your conclusions be different?
It would be we need to evaluate that. Yeah. Thank you.
And that's actually, thanks Norbert, that's actually a great segue into another session that is coming up later about a potential biomarker that could give you that level of information over that shorter period of time. So thanks. Thank you, Nastya.